Surginus Klosure is available in various sizes to suit different types of surgeries. For Klosure 03 and 06 products, Protective Film 1 is located in the center. So secure the center first. Then remove the Protective Film 2 for application. For other sizes, Protective Film 1 is located at the end of the product. So secure the left part below Protective Film 1 first. Then remove Protective Film 2 for application. The proper subcutaneous layer suture must be completed before applying Klosure. Klosure should be applied to clean, dry skin that is free of exudate, skin oil, or hair. When applying to the knee should be bent at a 45-degree angle. Before application, disinfect the surgical site and let it dry completely. Remove Protective Film 1. Position the product so that the incision is in the middle of the device. Attach the hydrocolloid to the skin. Then remove Protective Film 2 and attach the remaining parts of the hydrocolloid to the skin. Then hold the handles with both hands and pull in both directions at the same time to close the incision. Make sure the incision is closed with proper strength and avoid misalignment or overlapping. If the straps are pulled too tightly, pull them to the side. And then insert the narrower portion of the straps into the fixation part to readjust. Lift each strap vertically. Place the surgical scissors blade flat against the top of the fixation part and trim the straps. Trim the straps as short as possible to avoid snagging on the dressing. After trimming, press down firmly on all the hydrocolloid parts again. It is important to ensure that the adhesive parts of the dressing do not come into direct contact with the product. Apply the dressing that is large enough to fully cover the device. After recovery, the patient can remove the product themselves without needing to visit the hospital. Moisten the hydrocolloid parts thoroughly with an alcohol swab. Then gently remove the device by lifting one end and peeling it along the incision. Surginus Klosure uses a non-invasive method to close incisions and can be used in various types of surgeries.